Hi everyone, I'm Sinead from Health for You, and this is Lucy, one of our students who's here. She's a fourth year degree student from
Southeast Technological University.
Thank you. That's a bit of a mouthful to try and remember. So what we were just going to do today was we just wanted to have a little chat amongst ourselves just to do about health screening, the diagnostic health screening that we have here, just to give everyone a little bit more of an idea of what it's about and the benefits of it and what it entails. So I suppose Lucy's probably just going to go through maybe some questions that she would have asked when she initially started here. She's well used to the screening now and to doing the screenings herself, but she's just going to go through the questions that she would have asked when she first came to Health for You. So
So what actually is it?
Okay, so point of care testing basically is, so it's a fingertip test where we're going to take some blood from your fingers and it goes into a little cassette that we have here. So we'll be opening this in a little while. So these are refrigerated cassettes basically, and they can only be taken out of the fridge for a certain period of time before you have your test done. And that's to do with the reliability of testing. So basically, we'll show you this in a minute. We're actually going to run through a test, but basically with the cassette, we'll put your blood sample in through here into the machine, and it's basically going to go in here, and it'll take, this particular one will take 3 minutes to read. And then the benefit, I suppose, of that then is that we're able to then tell you this is your result, and depending on that result, what you might need to do from a diet and lifestyle point of view.
Yeah. So what can I actually get tested?
Okay, so this particular one is an inflammation marker. So this will tell us our levels of inflammation that may be going on in your body.
Okay.
So no inflammatory marker test, whether you have it done in a lab or something like point of care testing here, it's never going to tell you where the inflammation is going on. It's just going to indicate whether there is inflammation there or not.
Yeah.
And then that's where, I suppose, looking at assessments or in-depth assessments like something in nutritional therapy, because they're 90-minute assessments, they give us a full an in-depth look at what's going on in your body, and that's where we're looking to see where inflammation is. Then we have things looking at cardiovascular risk. So it's looking at your cholesterol. We're looking at their diabetes, the HbA1c, and the ACR for kidney disease. So these are all gold standard testing that's used across the board to diagnose people's risk. So we're looking at measuring your blood pressure, your weight, your height, your waist, your full BMI measurements, and we'll go through your medical history, your current medical history, and your past medical history, and your family history, because that's all going to dictate what your risk may be. And then at the as that consultation goes on, and we're chatting as we're doing the bloods, so then based on those bloods, then we'll be able to advise you what risk you may be at and what you can do to change that risk.
Okay, brilliant. And so what would be the difference from getting it done here as opposed to a GP?
Okay, so I suppose the benefit is that it's instant, so it's rapid results. Okay, so you make your appointment and you come in, but you're getting your results. You're leaving your consultation with your results and with your lifestyle and dietary advice. Where obviously when you go to your GP, you've got to wait for the results to come back from the lab, so they go to a normal lab. And you've got to wait those few weeks for the results to come back. And then depending, I guess, on your results, it depends, you may be referred on to somebody else to discuss those results, like a dietitian or something like that, where here you're getting everything all in one consultation. So you're they're leaving with everything.
And would anything like health insurance or anything cover this, or is it all?
So again, it depends on the plan. It depends on your health insurer, and it depends on the plan that you have. So some people will be covered for it and others won't. But yeah, so the best thing to do is check with your health insurer if you are booking, or
Very good.
So I suppose some of the other things that we do on top of, say, the cardiovascular is something like the hemoglobin. So that's checking your iron levels, and that's done on this little machine here. So what we might do is we might run through doing one of these tests while we're chatting. So how have you found kind of when you've been doing this testing yourself, Lucy?
It's actually like I never heard of it before here.
Okay.
But it's amazing how fast, getting the results straight away, and it's so easy to do.
Yeah. No, how do you find the process of, because Lucy has been doing health screenings for us as well, so
I think it's really interesting, and painless, and
and how have you find having had your results kind of there and then?
Brilliant. Oh, it's not knowing is the big thing.
It's the waiting around.
Waiting,
sometimes,
yeah.
isn't it? Yeah, so we're just going to give your finger a little up here. So what I might get you to actually go and cross your legs. And it's always beneficial once the hands are warm, because particularly in the winter it can be hard to get a little kind of. So what we're going to do is we're just going to give her finger a little prick. Okay. And then we don't use the first part of it. And then we're just basically, see, we're just going to fill this little pipette that's here. Okay. And it goes into cassette. So if you want to hold your finger on that for a second, Lucy, so it just goes into a cassette like that, which is going into the machine here. Wow. And then I just add in the details of the patient. So what's the difference you have found, Lucy, with what you might be learning in college that's out here, or would you learn about anything like this in your course?
So for college, it's obviously a lot more. We learn more about plans and stuff, whereas this is real preventative health.
Mm-hmm.
So it's finding the cause, finding the issue before it's there. Yeah. So it's completely, it is different, but
and so it's not something you would have heard about.
No.
You would be talking about in college.
And would there be many of these machines around Ireland, or?
There isn't very many, so this is one of the only ones in the community around Cork and around around Munster. Unfortunately, they're fantastic devices. In hospital, you may see them in hospital settings, and they are portable devices, so it's the very same as lab testing. And they have been approved by the International Federation of Clinical Chemistry and the International Glycohemoglobin Standardization Program.
Brilliant.
So they, you know, they really are fantastic tests, and they really do give you the overall picture of what's going on. So you can see in here that the test is just reading here. And this one just takes 3 minutes. So what we always do then is that we will give people a printout of their results. And we will be going through somebody's assessment with them now while we're blood results are reading. We'll be going through their medical history and their family history and that to get an idea. But basically, like this, I don't know if you can see this very well, but this is what you go away with, is with whichever test you're having done, the results will be on this. So you can take this away to your GP if you need to, or just for your own records to have everything. And then we'll give you dietary handouts to go with that. And we can give you some there and then, or we can have them emailed on to you. So that's really what it's about. Okay, so you can just see now that Lucy's her results have shown up. So what we do there is we can print off the results, and that's basically it. That's how quick it is. And then she goes home with her results, and we will be discussing this with her, which I'm obviously not going to do here on camera, confidentiality, but I will be discussing the results of this and looking at her, you know, her risk and her preventative health, and giving her all the information to go home with. So that's basically what health screening, point of care testing here in Health for You is at. Have you anything else that you
no,
that you think of that? Okay, thank you.